One aspect of the pandemic that has been almost criminally overlooked by the political establishment is the impact of long COVID on children. Yes, children get it too, and many are still unwell over a year after getting ill. In this film, I talked to respiratory consultant Dr Binita Kane, the founder of Long COVID Kids Support Group, Sammie McFarland, and Italian paediatrician Dr Danilo Buonsenso about the scale of the problem, how it presents, how to help your child if they're affected, and what the knowledge is at the moment around treatment. I hope you find it useful. First of all, could we just start by moving around across the top of my screen? So that'll be Binita first and then Sammie. Just tell me in sort of 30 seconds-ish, a little bit about your background and how that's brought you to a place of talking about kids with long COVID.
Hi, I'm Dr Binita Kane. I'm a respiratory consultant working in Manchester in the UK. And I also have a 10-year-old daughter who has long COVID. So that's why I'm here today, to share my experiences as a parent.
Thank you. Sammie.
Hi, my name's Sammie McFarland and I'm the founder of Long COVID Kids, an advocacy and support group. I have a daughter who was 14 when she got COVID in March 2020 and 15 months on is still suffering. And I am a Pilates and wellbeing coach by background and trained as a maternity nurse. So I am very interested in children and chronic health.
Yeah, thank you. Danilo.
Hi, I'm Danilo Buonsenso, a pediatrician from Gemelli University Hospital in Rome, with a specific clinical and research focus in pediatric infectious diseases and global health. And I've been working a lot in the field of infectious diseases, and in this specifically during the last 2 years in COVID and long COVID.
Thank you. So maybe we could start with you, Binita. Could you tell us a little bit about how your daughter has experienced long COVID and how it presents with her?
Yeah, I mean, before Jasmine was ill, she was just a normal 10-year-old. So she was doing swimming, gymnastics, karate, cycling, very active. We loved the first lockdown, actually, because we were all out on long walks, and she had no health problems whatsoever. And then in January of this year, she had what I would say was quite a mild viral illness. So she had a sore throat, some temperatures. But there were some features that really made me think this is COVID, that she had a very altered sense of taste, and she was very fatigued afterwards. At the time, I had 2 colleagues in my office who'd gone down with COVID, and I'd just done a week on the respiratory wards, but I'd actually been vaccinated. And she hadn't been anywhere for the few weeks before she was ill. So she didn't test positive for COVID, but there was enough there that I thought that's what she had. And really, since then, she's suffered with fatigue, meaning she can't take part in normal activities. She can't do things that a normal child who isn't ill would be able to do quite easily. If she exerts herself, she's very tired the next day. When she has overdone things, she will have relapses where she can get temperature, she gets very sore throat, painful glands, and abdominal pain, ankle pain. And this has just been going on. And the big turning point for us was when she went back to school in March, and that made everything a lot worse. So we've actually had to take her out of school now, and that has really helped with recovery. So she's very, very slowly getting better, but she can't do more than 2 hours, I would say, at the moment in school. And we're having to do this adaptive pacing program with her where she has to have almost scheduled rests during the day. And it's just really challenging for someone who's 10 years old and she just can't do any of the things that she loves. It's heartbreaking.
Absolutely heartbreaking. Sammie, how similar does that story sound to your daughter's?
Yeah, quite similar. Kitty had a very mild initial infection and had 1 day of a raised temperature, and then went on to have really severe chest pain, heart palpitations, dizziness. She was fainting. She couldn't walk. She went very floppy, almost like her limbs had gone sort of melted. She was like melted. It was just bizarre. I'd never seen anything like it. She had, and still has really bad insomnia. She's had menstrual cycle changes. pain in her limbs, so muscle aches. I think probably the heart and chest pain that she reports has been something that's been the most worrying, but the hardest one to deal with has been the dizziness and the fatigue, the hardest ones to deal with, because she's approaching 15 months now, and she's and like Binita, we took Kitty out of school, kept her home. Then when she did go back in September, when all the kids went back, she managed a few weeks before she then relapsed really badly, and then we kept her home until January. And then when she went back again, we've had to build up slowly, and she's managing 4 hours most days now, but then we're still pacing. She has rest breaks during that time, and most of the rest of the time she's spending resting so that she can achieve those 4 hours.
So hard, isn't it? It really is. Danilo, can you just tell us a little bit about what you've seen in your sort of clinical practice?
Yeah, so since I would say last summer, I was initially interested to see if the long COVID or persisting symptoms issue was something that was interesting children as well, because my adult colleagues working with adult patients described for the first time so I was curious, and I called some colleagues around the world that will develop this symptom survey. And see, because at that time I was not yet seeing these patients in my clinic. I am a clinician, so I work both in my pediatric ward and in the emergency department as well. And during this study with a few hundreds of children assessed both in my institution and also by family pediatricians in my same area, we were a bit surprised by finding that several children were having persisting symptoms. And at that time, we were between just at the end of the first wave, and several of these families were not seeking our clinical advice, because people were still worried about coming to the hospital and wherever. After we published the preprint, I have to say that several pediatricians, just like I opened a new door, several pediatricians started calling me, but I have this child behaving like this, I have this, can you give me an opinion? And given the growing number of numbers, sorry, you maybe lose me, right?
Yeah, we did, yeah.
So I'm so sorry, don't know why I'm with my Wi-Fi. Maybe I switch with my mobile phone.
Yeah. If you want to switch, I'll just ask the other guys a question whilst you're switching.
Okay.
Sammie, can you tell me a little bit about the scale of the problem? I mean, what are you seeing in the group that you've set up? How common is this?
So, we have 3,000 children in the group now, and continuing to grow. We saw a big increase in numbers just after Christmas. And the children that originally joined, so the marchers, as we call them, they are still ill. And that's really concerning. And we're particularly worried about the language that's used around long COVID. And there's very much this kind of 12-week mark that's talked about a lot. And that actually sets expectations. People think that they should be recovered by 12 weeks. And if they're not, that they're doing something wrong, or that there's a problem. But what we're seeing actually is that it's very common for families to have children that are ill for 8, 12, 15 months and still not yet better. The ONS has reported on the size of the problem, but their symptom list uses 21 symptoms. And if children don't fall into those that bracket of symptoms, then of course they're not recorded. So while they're saying it's sort of 8% in the older age group and 7% in the younger age group of children that get COVID will end up with long COVID, I suspect and anticipate that that's actually going to be much, much higher.
And how different is the presentation? Is the presentation as heterogeneous amongst children as it is amongst adults? And B, is it different between kids and adults? if you know what I mean.
Yeah, so we see that it is predominantly girls in our group, and when we did our clinical review with Danilo, we found that 56% were girls, and actually that trend has continued. I'm sorry, Jess, my brain fog's just gone. I've forgotten the second question.
That's all right. It was to kids. Is there a different trend in terms of the way they present compared to adults with long COVID?
Yeah, so in the children, we quite often see a lot of rashes. Not actually for my child. My child hasn't had a single rash, but for most children, they seem to report the rashes. And the dysautonomia, the dysregulation of temperature seems to be a huge problem. Fatigue, again, is another issue. But more of the sort of frightening symptoms that we get reported, paralysis. We've got children that have lost their mobility, and they've been put into wheelchairs and have been there for many months. We've got children with severe nerve pain, and they report it like electric shocks. And we also have children who have previously been very articulate and able to perform well at school, and now are struggling with regression. And, we've got a 17-year-old, for example, who's regressed to the behaviour of a 6-year-old. We've got children who have obtrusive thoughts, OCD, nightmares, terrors, these sorts of things. So we are seeing a lot of neuropsychiatric symptoms, which are, I don't think, as well reported in the adult group.
Wow. So heavy. Danilo, good to have you back. Could you tell us what you're seeing in your practice, and also what are the range of ages of children that you're seeing affected?
Yes, sorry for my connection before, should be better now. So, as I was saying earlier, since we published our preliminary study highlighting that children were having persisting symptoms, I suddenly started receiving so many emails and calls by both pediatricians and parents. It was like I had the feeling that suddenly I will kind of open a door, and everyone who had some issues COVID found the bravery to confess what was going on. And because up to that time was very common for these families and for patients to think this kind of something psychologically related to restrictions and whatever. Since then, given the growing number of calls and emails, we're starting with a dedicated outpatient clinic, which we have on a weekly basis every Thursday, with growing number of post-COVID children, where we either see children that completely recovered, but still also a number of children with a very new specific clinical picture to me, because as I was saying, I am a clinician. I also work in the emergency department, where I see commonly psychiatric issues, psychiatric illnesses, kind of clinical practice. But in this case, in this month, I'm seeing a very a new clinical picture, honestly, because it's the first time that I see children and mainly adolescents clearly telling me that they have struggled to be back to their normal pre-COVID routine. There were children that most of the time have no pre-COVID conditions, pre-COVID illnesses. They were having school activities and post-school activities, normal sport. So very normal life. But
oh, we've lost him. Binita, whilst we wait for Danilo to come back, could you tell me a little bit about what you've tried in terms of treatments, like along the last 15 months? Danilo, we'll come back to you in a second. I was just starting a question with Binita. Can you tell me what treatment strategies you've tried over this period, and which ones have been effective?
Jasmine has been diagnosed with ME-CFS. So CFS stands for chronic fatigue syndrome, and she didn't have any of the features of chest pain and tachycardia and sort of fast heart rate palpitations, rashes, which a lot of the other children are reporting. So in terms of treatments, really, we haven't been offered any proven treatments. The adaptive pacing, which is treating her symptoms as having an energy envelope, so she will wake up with a certain amount of energy, and then she will only be able to do activities within that energy, and she needs to rest before she burns too much energy. So that's kind of been the way we have been managing. I've made sure that she's having vitamin supplements, just because that is something that lots of people are trying. I've no idea whether that's making a difference or not. I don't think we know, but I certainly don't see there being any harm. Making sure that she's very hydrated, because sometimes she gets a little bit dizzy when she stands up, and I think that's probably because she's not drinking enough water. But actually, for the ME chronic fatigue syndrome, there isn't anything else specific that I know works for that condition at the moment. And I know there's lots of different things that people are trying, but I haven't gone there with most of them.
Yeah. So Danilo, if you could just continue, and also then just address this question of treatment as well, for how you're sort of going about and trying to treat the children you're seeing in your clinical practice. It's okay.
So I was saying this very characteristic picture of these children with extreme fatigue, struggling to go back to their normal post-school activities, keep school standards, and most of the time, along with frontal headache, chest pain, tachycardia, muscle joint pains. So what we have been doing is trying to understand what is the pathophysiological background to this condition. So what we have been finding is that these children with persisting symptoms, specifically those who have symptoms for more than 3 months, we are finding this, although the routine test looks all normal, most of these children are having a specific immunological background with a slightly raised pro-inflammatory cytokines even months after the disease, and also with a cellular dysregulations compared with the children that fully recovered from COVID-19. It was something, I don't want to go into full details, but we are finding a cellular pattern somehow suggests that some chronic inflammation is going on, and this immune system, specifically the B cells, looks like it's still fighting something against something that we don't know fully. We don't fully know yet, but this is really in line with new findings from adults, where we are finding that some viral particles or antigens or viral persistence may somehow stimulate this chronic inflammation, which will very well fit with a picture of fatigue, muscle pains, or whatever. And very recently, we have this paper just accepted by an important journal, for those children belonging to the most severe spectrum of the conditions, with symptoms lasting for about 6 months, chest pain, tachycardia, extreme fatigue. We have been finding some lung perfusion defects in these children. And therefore, I'm saying this because this brings me to the treatment options for this very severe spectrum of conditions for which we proved immune dysregulations and organ damage. We don't know data. We don't have enough data yet to say this is the treatment. But for these children, after a multidisciplinary meeting, and also directly involving the parents and children as well, we decided to treat with steroids for the inflammatory background and anticoagulants for the lung perfusion defects. For the other children, the mild or moderate spectrum of long COVID, we are trying with some immunomodulators like polyvitamins, lactoferrins, and also the probiotics, since it seems that also some microbiota dysregulation may somehow play a role. we will need, a standard trial to do this, but it's very difficult to have approvals for these trials because even the of long COVID is not well defined. So it's very difficult to find a very specific clinical picture and to decide who will need the placebo and who will need treatments. But for now, since we need to give answers to families, we are trying, we are behaving like this.
Yeah, it's amazing. Sammie, I mean, in the UK, we're struggling to get adults into long COVID clinics. I'm pretty sure there's very little support from the medical community for children that's specific in terms of research and ongoing. Could you just tell me a little bit about that and about what the experiences of other patients in your group are around how they're going about trying to address how they treat the condition for their kids?
So the paediatric COVID hubs have just been set up by the NHS, and right. We've got the first couple of families that have got referrals to those. Not all of those hubs are in operation just yet, so it's all very new. So we'll be reporting back on that. We're going to do a survey on their experiences. In terms of treatments in the group, really, most families come to the group to ask us about, what can they do, because they're not reading or finding any information anywhere else. And the things that we're suggesting and that we've seen benefit from is working on gut health with low antihistamine probiotic. Good quantities of vitamin C, vitamin D. And obviously we haven't done a trial on this, but we can just report on the families that are using them seem to report back a reduction in symptoms. So that's helpful. Low histamine diet it has been reported, and as well as, magnesium, niacin, what else are we using? I think they're the main ones, but that definitely gut health seems to be an issue. So for a lot of the families that have had the ability to pay for private testing, have had stool and hair sampling tested, and have found there's been a consistent finding within those children of missing minerals and it seems like a low absorption. So where those families perhaps did have good diets and were surprised to hear that their children had poor levels, we think it must be to do with absorption. Something is physically stopping that good nutrition getting in. So again, working on gut health has been really helpful, but we don't have any evidence. We need research, and we need longitudinal studies on this.
I mean, it's a very similar situation for the adults, and a lot of what you're talking about there are the same sorts of things that a lot of adults are finding help with as well. And leaky gut, I think, is a problem with adults, and gut health generally, and enteric nervous system function these are all big question marks and places to look and to direct further research in both communities. And it's just, the machinery of research does not necessarily always move very quickly. I just wanted to move on to sort of the psychology of this and how difficult it is to deal with this. Binita, could you tell me a little bit about the challenges of this from the role of being a parent, and also the challenges for your child as well, in terms of just how difficult it is to deal with, long COVID as a parent and as a child?
It's been very, very interesting for me to be sitting on both sides of the fence. So I have been involved in conversations about setting up the services. And so from that aspect, I see that there is hardly any funding, that an NHS that's already completely overstretched, overburdened, has lots of people off sick with long COVID because our front line was hit so hard, trying to recover all the backlogs of stuff that's built up over the pandemic, and just about to go into a wave 4, for NHS professionals trying to deal with this without any extra, with very little extra resource is very, very challenging. So I see that side of things. And then I read the posts on long COVID kids, which break my heart every single day, with the struggles that families are having accessing the right support. And I think doctors are being faced with a really difficult problem. This is suddenly something we have never been taught about. We are, they have very poor understanding of anything to do with chronic fatigue and post-viral illnesses. It's been dismissed by the medical profession for many years as sort of being psychological, and not having any basis in science because we don't understand it. And it's really sad, actually, that it's taken a bunch of healthcare professionals to get really ill, or their kids to get ill, for this topic to be getting a lot of attention. And I think as a parent, because I understand both sides, it's easier for me, but I sense the frustration and the anger in the group of parents who are being fobbed off. They see it as being fobbed off by healthcare professionals because they don't understand it, and they say, well, there's no problem, I've done the tests, there's nothing wrong with you, off you go, I've got a backlog of 1,500 other patients to see. And yet they are in a battle every single day with their child, struggling to make sense of what's happening and how they can help. And it's been devastating for any child and any family who is dealing with this. And I feel lucky that Jasmine's in that milder, more moderate symptom group, but it's still been devastating for us. So it's just this really difficult dynamic. I think there's a lot of anger aimed at healthcare professionals, but that the reasons why healthcare professionals are reacting badly to this situation is really multi-layered. And ultimately, we need a lot more investment. We need a lot more support. We need the government to take this seriously. We need amazing people like Danilo and other researchers to be given funding to do more research. It's just a really, really difficult and challenging situation for everybody involved.
Sammie, could you tell me a little bit about how kids deal with it, and what parents can do to help their children who are struggling to understand what's wrong with them? What can parents do to help their children?
I think the first thing they can do is to listen and to believe and to validate that the child's symptoms are real, because what we've seen is that the children who were ill in the first part of the pandemic, their mental health has been much more affected by not being believed and by being told it was anxiety. And I think that's been hugely damaging. So we need to be careful about the language that we use around our children, and also ensure that the professionals that we see are careful about the language that they use around their children. And then secondly, we need to set the child's expectations correctly. So we need to, praise the positive days, but also gently remind them that it's a relapsing and remitting condition. So we need to be careful about giving them hope. We need to give them hope, but also not to promise them that they're going to be better by a certain point, because the children that have been told, well, don't worry, you're going to be better by 12 weeks, or you're going to be better by 6 months, those children really, really struggle if they hit that marker and they're still not better. So I think setting expectations is really important. And lastly, keep going back to your medical professional and don't be fobbed off. So just keep taking if your child is presenting with new or worsening symptoms or ongoing symptoms that you're unable to manage, keep going back and let your child know that you're fighting their corner, because definitely that's what we all need to do.
And speaking of recovery times, Danilo, what are you seeing amongst your cohorts, and what kind of, are you seeing recoveries? How long does it take? Is there a certain phenotype of presentation that's more likely to recover? What are you seeing?
We should start from the concept that most, of the long COVID pediatric cohorts, we are starting seeing them since the end of last year. So we mainly have 6 months of experience in the field. I have to say that from the first wave, I have almost no patients, because in Rome there were during the first wave, most of the cases remained in the north of Italy. So we had very few cases, and interestingly, despite severe restrictions, I have almost no long COVID children from the first wave. But I have the large majority from the second wave in October and November. we have been seeing some improvement in the mild children that mainly had headache or some muscle joint pain after 4 to 6 months of symptoms, while for those who had mainly cardiovascular pain like fatigue, extreme fatigue, or like mild dyspnea or mild tachycardia after even mild activity, for those we did not have self-recovery, but we are seeing improvements since we started the main therapies I mentioned you earlier. These are those children for which we found immunological dysfunction and also the lung perfusion defects. So I would say that the moderate, mainly the most severe spectrum, will need much longer. I fully agree with what Sammie just told, that what I do is I clearly talk with families about the expectations to have. I told them that we do not yet when this will end. I talk with children as well, because most of them are 8 or 9 years old or older, so with the proper language they are fully able to understand what they can do and what they should expect. But I have to say that for the family as a whole, the whole perspective changes when they found someone who will say, okay, we don't know yet, but we know that something is going on. This is not something psychological. So we will try to investigate whatever we can, and we will do our best. As also Binita was saying, unfortunately, we have not much experience with chronic illnesses in general, because they're not attract funds from major agencies and drug industries. So this COVID time are a huge opportunity to better understand the chronic medicine as a whole. Although I have to say that for children as well, we still have zero found. In my clinic, it's just me and one resident. We just delivered 2 days ago. And so, but she is still really enthusiastic, so she will still support me somehow with zero found. And this topic is extremely challenging because we need the pneumologist, the cardiologist, the nuclear medicine, the coagulatory team. And it's very difficult with no resources, which is very common in every healthcare system. And let me say, country. And so this. So this is my experience. Clear expectation, but communication. They have family as my phone number as well, private numbers, my WhatsApp. And they have kind of a person to refer in case something changes as a worse or improves. And they start a journey together. And this is already something changing in my experience.
Could I just... could you just tell me a little bit about that relationship between paediatric inflammatory disease?
Paediatric inflammatory condition is paediatric inflammatory multisystem syndrome is the COVID complication for children, and it's treatable in hospital. But you have to be able to find somebody who can recognize it and then give treatment. And we are very interested to see that there are a cohort of children that seem to have the same symptom sets, the same pattern of behaviors within their COVID recovery that would indicate that they're consistent with having had this condition. So we wonder whether there's almost like a watered down version of PIMS that children get that isn't enough for them to have been hospitalized at the time, but actually that the ongoing problems are the same and their symptoms are the same. They have the same sort of strawberry tongue that comes with PIMS. They have the same symptom sets. But again, we just need that research.
Yeah. So I was wondering if I could get each of you to just give me if you had one piece of advice that you could give to, to maybe both to maybe a parent who had a child who had long COVID, and to the child
We
themselves.
lost you, Jazz.
Oh, okay. I'll start again.
We've lost you, Jazz.
Am I back? I think I'm back. Okay.
We can hear you just about.
I mean, who knows what's going on with technology these days, right? We've all got fiber optic broadband and it still doesn't work. Anyway, so Binita, I'll start with you. If you could offer one piece of advice to a parent who thinks their child might have long COVID, what would that be? And if you have a piece of advice for the child as well, from your experience, the one piece of advice that would be most useful in your experience that you maybe wish you'd known from the start, what would it be?
Can I do one for healthcare professionals as well?
Absolutely. Please.
Yeah. My advice to healthcare professionals would be, as Sammie has already said, please listen to the child and please take their symptoms seriously. And what patients and families need is humility and honesty from healthcare professionals. If you don't know, just say you don't know, and don't tell people there's nothing wrong. I think that would be my biggest piece of advice. For parents, please don't allow somebody to dismiss your concerns. You are the expert in your child, and you know when there's something wrong with your child. And if you can't get answers, get help and get advice on somebody else you can see for a second opinion or a third opinion or a fourth opinion. Don't give up and feel like, there's nowhere to go. And for children, what I say to my child is, this is the situation we're in. I practice acceptance with her, that, let's just accept this is where we are, because if you want to just do everything you could do before, you'll be very frustrated. This is going to be a long journey. But I'm really hopeful that you will get better over time. It's just going to take a long time, and however you're feeling is okay. And that's kind of the advice I give my own child. That seems to work, actually.
I mean, acceptance is one of the hardest things as an adult with long COVID, and I've battled with this for over a year. So, I mean, for kids, it must be doubly hard to not have the perspective, right? It's so much harder. Sammie, how about you? What would be the bits of advice you'd give to parents and to children?
So to all parents, I would say, please don't prioritize education, prioritize recovery, because health is our wealth. And, if we get better, then we can study at a later point. And I think that that's just such an important thing to remember. There are so many pressures as a parent, from the school, why is your child not attending? They should be back in by now. Perhaps from other members of the family, and even from the children themselves, because they're worried about dropping the balls, particularly for those children that are in year groups where they're doing exams. So we have a phrase where we say less hair, more tortoise, and we just want everybody to really slow down and know that the only thing that we're seeing at the moment that really makes a true difference is time. And there is no pushing through, there is no fast track system that we know of yet to get better. So that would be our main bit of advice for parents. And then for the children, keep telling your parents how you feel, keep telling the doctors, repeating how you feel. Know that what you think matters. This is your body and you have a right to be heard and a right to help. So please keep repeating as many times as you need. But also I'd like to echo what Binita said, helping the children come to terms with accepting where they are right now and finding ways that will support them, finding things that they can do that will bring them joy in their day, that isn't just about recovery, education, but actually little things that just give them little lifts, because they still need exactly the same little lifts that all children need. Those are my two bits.
Amazing advice. Thank you. Danilo, do you have anything to add to this?
It's very difficult to add to what they incredibly well said, comprehensive on any perspective, really. I will fully highlight and underline their messages. And I would just say to my colleagues that really we need to stop thinking this is something psychological. We have a family asking for advice, even in case this will be something psychological. We are clinicians, first of all, when we decided to graduate in medicine and then to specialize in pediatrics or whatever. So before research, we need to take care of families and children. So this narrative, psychological or not, really makes no sense when we have in front of us families asking for help and support, because reducing this, it's psychological, go home, will not allow us to make our work. So really, we need to take care of families. And about children, I would say, children are the strongest humans in the earth, and so I would tell them, you are the best here, and I'm confident that sooner or later life will be amazing again.
So I'm going to put you each on the spot now. If you had infinite resources and with the click of your fingers, much like Thanos in Infinity War, and if you watch Marvel or not, but you could commission any research projects you wanted into the subjects of kids with long COVID, what would it be?
I will ask for a long COVID clinic with a pediatrician, the immunologist, the radiologist, the nuclear medicine, the coagulation team, and infectious disease, and the rheumatologist with a dedicated lab, because I say the long COVID, it's a long COVID revolution, and as such a fund will help to understand hundreds of diseases. Will be something so effective even on a health economic perspective, because if you understand this, we will understand so many post-viral illnesses, also the post-immunization conditions, everything which is somehow related with an immune or acute or inflammatory trigger, which we don't know yet now. This will be such an effective investment in this area.
Yeah, I completely agree. Sammie, can you think of a research project you'd like to commission?
I can. So with the amount of neuropsychiatric changes we see in children and these ongoing symptoms, I'd really like to see research into gut health and to look at that gut-brain link. And, is there something lurking in the gut that's stopping the absorption? Is it lurking long enough? Does it go via the vagus nerve to the brain? What's happening? I'm intrigued by this subject. So yeah, that would be my magic wand waving wish, please.
Yeah. Binita, do you have one?
Yes, thank you. I've had a bit of thinking time now. So my research question would be really trying to understand the mechanism of post-exertional malaise, because I think this is a huge part of what is stopping our kids from doing normal things. And it's not a new phenomenon. It's been described for 30, 40 years in the context of ME. And we have not put really much research or funding towards it. And I think that could be something quite revolutionary as well, to help a much wider population of people who are chronically ill.
I couldn't agree more. So thank you all of you for sparing this time on your Saturday mornings. I think it's incredibly valuable. The more airtime I think we can give to this subject, the better. My take would be, I think there's a lot of parents out there with kids who are suffering who maybe haven't identified what's going on. And I think this problem is probably larger than what we're seeing at the moment. So anything that we can do to raise awareness of this and to help parents who do have kids that they know are struggling, I think will be incredibly helpful. So thank you for all of your time, and let's hope that this subject can move forwards in terms of knowledge and understanding and recovery for the kids involved as well. So
and thanks for all you're doing, Jez.
Yeah,
thank you very much.
Thank you very much.
Cool. Thank you.
Sorry, Jez, for my initial connection problem.
Don't worry, it's all good. Thank you. Next up on the Expert Interview series, I talked to microbiome specialist Viola Sampson about the critical role of the gut in long COVID, prebiotics, probiotics, and how we should adjust our diets to give us the best possible chance of recovery. Till next time.